My name is Thomas. I graduated from Griffith 2022. Then moved to Rockhampton for 3 years. Just moved to Brisbane, working at Pure Dentistry. I always liked to get into more aesthetic dentistry, and I think just trying to get into the mind of the people who are very good at it, Dr. Samko and just like you, it's very beneficial for me to see how you guys go about it. And as I can apply the same skills and talents that you guys have to my line of work. Oh, well, there's a lot of things. I've never had a mentor. I've never had any courses that was about aesthetics. So it's been a lot to process. And I'm just like trying to remember everything, taking notes down and trying to go through the notes again. I think a lot of it comes from the kind of a mind block that I've been having, trying to kind of convince the patient to do veneer, but then not knowing, how to go about it. And I think a lot of the steps are kind of watered down now. They're a lot easier now to process. Before it was just, okay, now I want to do veneer. How do I go from step 1 to A to Z? And now I think like a lot of steps are kind of a lot easier for me to process. And it's good that they gave us a booklet, made it much easier to follow the steps. And I like that, and I like to have steps. And I think just trying to remember the steps, going one by one, makes it a lot easier. I think just having a few patients so I can apply the steps will make it a lot easier. I think just like how easy Dr. Sam does things. It's just like, when I think about it, when I want to do it, it's such a monster, but I think he made it so much easier to kind of grasp it. And I think like it just kind of removed that mental block that I've been having. And it's like kind of excited to go about it now. It's like when I talk to my patient tomorrow, the day after tomorrow, I'm more comfortable to convince them to start doing veneer. So I think if you ask me like what did I learn from this overall, I think just like that mental blockade is gone. I just came from Cambodia. I did a implant course for, I think it was a week, the implant course. It was very good, but then it was just all hands-on. I think like the good thing about this course was that it combined the theory as well as the practical equally. And a lot of courses are out there, they're just all theory. I'm a kinesthetic person. I love to learn hands-on. And I think just like that combination of just like theory and then go into hands-on and then give a break, come back tomorrow, again, theory and then hands-on, makes it a lot more easier to, kind of listen to the theory. I just hate the theory, but makes it so much easier to listen now. So I did a prep 4 to 4, upper 4 to 4. And I think like the interesting thing about it was that, placing the temporary first in and then doing a bulk prep, which was very interesting to me because like I used to just prep one by one and it would take so much time. And it's like Dr. Tamko said, like, just like put the temporary and just don't think about it for 80% of the time. Just go for the bulk removal, and then take the temporary off and then do the kind of a more delicate prep. And so that made it a lot easier to go through it. And so like we've done the prep yesterday, and today we're going to hopefully cement it. For the design, forgot the company's name. Yeah, the lab. They were very nice to that, to say that they would, make the veneers for us. I've never seen any course that does that. So that was very amazing. And so that we can not only just learn it and Dr. Sam talks about it, but also apply whatever he's done to kind of a, not live, but kind of actual patient that he has done before. Oh, definitely. I think like a lot of, I think a lot of people who are in dentistry are kinesthetic. So I think this kind of course is beneficial to anyone who's in dentistry. And so, people who are into more aesthetic and stuff like that, this is definitely the course for them. Yeah, definitely.